Hi, everybody. Just trying to pull up a different screen. One second here. Be right with you. I'm going to cover a new treatment for PTSD that's come out. And it's not a pill. Thank God. Thank God. Dr. George Lindenfeld is who has developed this theory. Trying to get it to where I can share the screen here. There we go. The article's brought to you. I found the article. Actually, the article was sent to me by my mom, who is a county manager in Florida. She sent me this, but it's coming, as you see, mountainx.com is where the story came from. But he is a neuropsychologist, Dr. George Lindenfeld. And what he has done is it's a biofeedback instrument that they're using. All right, it's, if you see it right down in here, bioacoustical utilization device. Right, there's George there. But essentially, what they're doing is sending a certain frequency into one ear and into the other, and they'll change in different frequencies. So you're sending two different frequencies into your ears, one on one side, one on the other, and each frequency lines up. We'll eventually find like this connection where when you're asked to reminisce on your event, on the PTSD, on what event it was that's been causing the PTSD or multiple events, visit them in detail as you're there, and then sending these frequencies to the brain. I am butchering the treatment mostly, but see where they say it. I know it's right down here. They were talking about Richard Carlin, who was with the U.S. Army, and he served. He was someone that used this. During the therapy, had me focus on the feelings that increased my heart rate, gave me cold sweats. After the treatment, he couldn't bring those feelings back again. You see, since then, he's kind of felt like a different person, kind of like he got his old self back. So it's, let's see, overwhelmed. They've earned it. Oh, that's right. It was trying to get to where it actually talks about the frequency itself. That's the system. People that are supporting it. They haven't done a full complete study on it, obviously, but being the VA so backed up as it is, and this treatment is not invasive as far as we know, with like drugs or psychopharmacology. So it could possibly be, if anything, something we're trying. It kind of reminds me of rapid eye movement therapy, where you watch a light in some sort of sequence back and forth that's supposed to initiate REM sleep. And in that REM sleep is where your subconscious is believed to work out things, difficult things that you've gone through, etc. But that's kind of what this sounds like to me, but it's sending, it's approved by the Food and Drug Administration, Class 2 biofeedback device. About 900 therapists are practicing it in the United States, which is good. Like I said, and like they're stating here, it can speed up the time. After 3 sessions with Lindenfeld, Richard Carlin could hear gunfire, jets, and helicopter and not have an emotional response like he said before. So it's kind of a desensitization device in a way as well. Person who suffered from paranoia, all types of issues, walked in skeptical. Sending frequencies. It's not too much detail in the article about the therapy itself. I was looking for an extent for a little bit farther, but to see how it applied. But if anything, Bring the screen back. There you go. If anything, it's just a sign that there's all sorts of treatments that could possibly help. I mean, think about how long we've been at war and how many veterans already have had to return home. Most of them dealing with some sort of PTSD in a sense. And they're when you do get into the VA, the care is not poor. The care is decent for the VA. Uh, but once you get in, it's a pain in the ass to just try to get in. When I don't understand why should be so much paperwork. I mean, it seems to me like the paperwork is what's slowing things down anyway. But if this bowed treatment, the biomedical feedback device, the class 2 in here, if it could provide even a chance, why not, while in the waiting room, if you will, at least try this approach, and there's so many different approaches out there that exist that don't include pills, that don't include having to risk taking certain pharmaceuticals, be that pain medications, be that psychotropic medication, any one. There's a lot of different holistic choices out there as well. Now, mind you, I'm not naive to tell you that you can treat everything holistically. There's certain medical issues that need to be treated, but when in doubt, it can't hurt to add it or try it first. I don't think we can sit in line and wait. I don't think the veterans and those returning home have that kind of time to be waiting. Antidepressants have their ups and downs, literally. It's risky to start that. There's other ways, to approach it. That's kind of what I'm all about when I do my therapy sessions. You can see on my website that I do certain sessions, whether it's the cognitive rampage session, full synergy sessions. I don't even call them out of the box sessions. They're new boxes, really. But there's all types out there, and this article, I think, points to that notion, is that they're beginning to think outside the box. I think they're thinking outside the box as well. I did an article review on using MDMA now for study. The DEA have allowed studies to now start being performed on that once again. Not that I'm supporting things that are synthetic, but it's a sign of thinking outside the box, at least, and like this is. And I think people like Dr. George Lindenfeld change the game, because they take chances, they study things, they present new ideas. And I think that's what keeps the human race on top of things, or moving forward, is that idea is always exploring different routes of treatment, different routes of learning, communication, travel, etc. That's important for us, I think. So, Dr. Lindenfeld, please keep up the good work. If you guys check the post on here, you'll see where you can look him up. But if you want to, you could probably just Google search within your state, BAUD therapist, and that's an acronym, BAUD. It's a biomedical acoustic device. But find one of those 900 therapists that are out there practicing that. And I'm trying to get Dr. George Lindenfeld on the podcast, actually, currently. So maybe he'll come on the podcast and tell us more about where this came from. But read more into it. Share it with a friend. Pass it along. You never know. You never know. Okay. Well, if you have any articles as well that you're reviewing or you're finding to be intriguing or cutting edge stuff, please email them to me or send them to us on any social media outlet site, whether that's Facebook, whether that's Twitter. On Twitter, you can find us or find me at Cognitive Rampage or Adam Lowery Com. But send us the Twitter ones. Email us at Cognitive Rampage at Gmail. Send us the emails in about the article that you're reviewing or that you read, or I'd like to review it. Maybe sit down with a couple other people. But all right. Anyway, also the podcast released today. It dropped our 5th session. I sat with pro MMA fighter Julian Williams, and I hope you caught the other podcast this week that launched on Tuesday. That was behavior analyst Jordan Holt, and we discussed autism. So those are the podcasts that are out. This was the article review here. Hope you're taking care of you.